Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, if you see the classification of muscle relaxants, they are divided into two types. First, there are peripherally acting muscle relaxants and centrally acting muscle relaxants. Okay, so first in the peripherally acting muscle relaxant, we have again two. One, we have neuromuscular blocking agents. Second, we have direct acting agents. Peripherally acting direct acting agents like dantrolene sodium is a direct acting peripherally acting muscle relaxant, and we have quinine. Then if you see centrally acting agents, we have mefenacin congeners. In centrally acting agents, we have mefenacin congeners, which include mefensin, carisoprodol. It includes mefensin, carisoprodol, chlorzoxazone. Then it includes chlormazonone. Then it includes methocarbamol. Okay. Then we have GABA benzodiazepines. In the benzodiazepines are also centrally acting muscle relaxants. Okay. Then we have GABA derivatives. GABA derivatives which are centrally acting muscle relaxants are baclofen. Okay. Then we have central alpha 2 agonist is also centrally acting muscle relaxant, which is tizanidine. Okay. These are the muscle relaxants. Thank you for watching.
Thank you and thank you for watching.